colic? What do we do when we don't know? ليه اخترت العنوان ده? Because there's a lot of things in infant colic that we really don't know. Maybe later we'll know more about it. My name is Marwa Deeb. I'm professor of pediatrics in Ain Shams University. This talk is sponsored by Splendid, introducing their new product of lactase enzyme supplements known as Easy Call. ما فيش صوت بس حضراتكم متخيلين الإزعاج اللي ممكن يكون حاصل صح؟ I'm sorry إن أنتم مش سامعين الصوت بس أكيد متخيلين اللي بيحصل. This is a sound torture. Sound torture is one of the 5 CIA known techniques for prisoners. يعني إزاي يأثروا على prisoners by sound torture, and infant colic is one of them. Because the peak of infant colic can reach up to 100 decibel, and this is heroic. If you search infant colic, you might get more than 18 million topic covering infant colic, and most of the data is confusing, conflicting, and most of it is not evidence-based. The prevalence of infant colic varies hugely, up to 8 to 40%, and the most common references measure a prevalence of 20%. It represents 25% of pediatric consultation. يعني وأنا قاعد في العيادة لو أنا عندي 100 عيان إن شاء الله 25 of them will have infant colic. It affects all infants, males and females, rich and poor, residents of rural and urban areas, preterms and full terms, breastfed and formula fed. It affects everyone. It peaks during the first 2 months of life, and then it declines and resolves spontaneously. This is the natural history of infant colic. The outline is introducing the definition, the etiologies, and strategies to cope. أنا كان قصدي active strategies to cope because كان نفسي أقول إن there is a treatment. There is no definite treatment. There are only strategies to help cope this time. Why infants cry? Infants cry because that's what infants do. هو بيعمل كده يا جماعة. That's the way he communicates with everything around it. He cries at different situations. He cries to tell you what he feels and what he wants. This is a completely normal phase of development. How we perceive it as caregivers and as doctors is what makes it different. في theory لطيفة قوي كانت introduced في 2008 اسمها the missing fourth trimester. المissing fourth trimester كانت introduced بفكرة إن البيبيز human babies are born 3 months earlier. مأساة طبعا صح؟ كأن pregnancy is supposed to continue for 12 months not 9 months. ولأن البيبيز are born 3 months earlier فهم قرروا ال 3 months دول ينكدوا علينا because they're missing their intrauterine life, the safe intrauterine life. واللطيف في الثيوري دي إن البروفيسور who introduced it يعني عمل comparison ما بين ال human infants and the horse infants. الهورسز بتتولد بعد horse babies I mean. الهورس بتتولد بعد 12 شهر من الحمل بيتولدوا very vivid and live ويقوم يقف ويجري ويتنطط because he completed the 4th month of his pregnancy. لكن الأطفال missing 3 months فعشان كده قرروا ينكدوا على الناس. This is a very nice photo that I always use in infant colic and other functional GIT disorders. It's all about how you perceive the symptom. It is a completely benign condition. It's not supposed to distress you enough. You have to make peace with the shadow. It is not a line. It's not a line. Definition. Infant colic is one of the diseases that fits the perfect definition of functional GIT disorder introduced in Rome criteria in 2016. It defines a group of diseases, كتير جدا جدا, infants and toddlers and in children and adolescents that have no organic cause that you can really catch and hold in your hand. It's a disorder that is present, but it has no anatomic, biochemical, or structural problem. Infant colic is one of these. As you can see, there's 7 in the period of neonates and toddlers. Infant colic is exactly in the middle. But one important thing is that in functional GIT disorders, combination is the rule. مش بيرجع, بس combination is a rule. What does this mean? It's not unusual to find an infant with colic who has reflux and constipation, or an infant who's colicky and has difficult defecation, known as infant dyschezia. This is perfectly normal. It's not one entity because the pathology is more or less the same, which is in large things that we don't know. Okay, this is the criteria of Rome for infant colic. Sorry, technical issues. The symptoms start and end below the age of 5 months. It should start and end below the age of 5 months. The cry is very characteristic. It's not the usual cry. It's not the usual cry. It's a cry which is hyperphonic, صوتها عالي قوي, louder. يعني كان نفسي الصوت يبقى مسموع. It's very, very annoying. It starts and ends with no apparent cause. دايما في clustering كده. الوقت كل اللي اشتغلوا في الحوادث والاستقبال عارفينه بتاع الفجر ده. من 5 بالليل ل 10 ومن 6 من 5 الفجر ل 10 وشويه حبه الصبح. So it has some evening clusters. ما حدش عارف بيعيط ليه وما حدش عارف سكت ليه. But the most important thing is that there is no failure to thrive, no fever, no features of any illnesses. ساعات بيبقى معاها features تانية. Frowning, flushing of the face. You draw his legs up. Arches his back. أنا حبيت أقول arches وأحط عليها exclamation mark because every infant who arches his back we think is reflux. It's not true. It is one of the symptoms that can associate infant colic. But what about the very famous whistle, the rule of 3? Haram. The rule of 3 is haram because we cannot wait to diagnose infant colic if the infant cries for more than 3 hours per day, for more than 3 days in a week, for more than 3 weeks. This is very distressing and frustrating. لكن ليها دور طبعا to establish some standard criteria for research and definition, لكن أكيد مش for clinical practice. What are the etiologies of colic? Colic is not a single etiology disease. It's actually a common pathway of many contributing factors. The large part of them is unknown. This is the large part, unknown. بعد كده يجي GI causes and then some biologic and psychosocial causes. Gastrointestinal causes بعد unknown هي أكبر واحدة because actually colic means in Greek pain of intestinal origin. So gastrointestinal causes are on top. Could be faulty feeding يعني إيه يعني over or under feeding. This can happen both in breastfed or formula fed. Over, underfeeding, inadequate burping, swallowing of air, كل دي حاجات ممكن تبقى faulty feeding behaviors. Intestinal hypermotility يعني there is hyperperistalsis and increased gastric emptying, and these are proven signs. إن الولاد الكوليكي عندهم higher levels of motiline hormones, higher levels of serotonin, كل دول بيزودوا الintestinal motility. Cow milk allergy with lactose dysbiosis, I'll talk in them later. Cow milk allergy as a cause of infant colic. Studies كتير جدا معمولة على role of cow milk allergy كلها تنبع من حاجتين أو من حاجة أساساً إن cow milk allergy is an inflammatory GI condition and infant colic there is proven inflammation in the GI. فيمكن هي دي اللينك اللي بيبدأ منها research, but definitely not every colicky infant is cow milk is having cow milk allergy. لكن you are justified to suspect if there is a positive family history of allergy, if this colic is associated with other GIT features, vomiting, diarrhea, constipation, bloody stool, or if this infant actually is having atopic dermatitis. So if you suspect, in these cases you can suspect cow milk allergy. The effect of lactose. Lactose is the milk sugar. So to be able to digest the milk sugar, you should have the lactase enzyme, you should have the lactase enzyme to split the lactose into galactose and glucose. So that's the normal pathway. You digest the lactose using the lactase enzyme, glucose and galactose بقوا reabsorbed the active transport. خلاص, this is the normal digestion. This happens in the small intestine, in the upper part of the small intestine. This is the normal. If for any reason, as I mentioned in the next slide, this lactase enzyme is not present, is not functioning as it should, then this lactose is not digested. Lactose is present in every milk, breast milk, formula milk, any milk. So if the lactase is not present, lactose is not digested, it will pass in the large intestine because no digestion happened in the small intestine. In the large intestine, in the colon, there is the flora. The bacteria will ferment the lactose into gases, mainly the hydrogen ions, which are expressed in the breath, and this is an important point. And gases, mainly, and the acids, short-chain fatty acids. Short-chain fatty acids are reabsorbed later. Why? This is very important condition known as colonic salvage to preserve the energy which is supposed to happen from the lactose. The resultant effect is lactose intolerance. Okay. And the lactose intolerance is a condition in which there is colic, distension, explosive diarrhea, and associated napkin dermatitis. So that's the normal and the abnormal. Lactose malabsorption could be primary or secondary. Primary lactose intolerance مش موضوعنا دلوقتي بس it can happen in any GI diseases, infectious, inflammatory, whatever. The primary lactose intolerance, أنا هبدأ من تحت لفوق. Congenital lactase deficiency is very, very rare. very like 40 cases worldwide, mainly in Finland. Autosomal recessive condition. Presentation is congenital diarrhea, يعني الولد ده من ساعة ما اتولد عنده diarrhea وعنده شوية associations تانية, hypercalcemia, nephrocalcinosis. This is very rare. Developmental lactose intolerance can happen because the lactase needs a very mature GI to be produced and to be expressed fully. So it can happen, but it's transient and it's more pronounced in the preterms, and it is a reflection of GIT maturity, will grow out of it once the GIT fully matures. Acquired is the most common. Acquired primary lactose intolerance اسمها الثاني lactase non-persistence. يعني ايه؟ يعني أنا كبني آدم the very normal phenotype is that my lactase activity decrease by age. As I grow older, my lactase activity decrease. This is a genetically programmed process. As I grow older, the lactase activity decreases. مش مشكلة. And then البوبوليشن بقى القليل اللي اللاكتيز عندهم بيفضل موجود طول ما بيكبروا. These are the abnormal population, and it's an autosomal dominant form of inheritance. Okay, so lactose intolerance and infant colic, is there a possible link? Many studies actually proposed a link between lactose overload and lactose and the developmental lactose intolerance and infant colic. This is proven, and الدليل عليه إن الولاد الكوليكي, when they consume milk and I measure the hydrogen ions in the breath, the breath hydrogen test, they show an increased level in hydrogen ion excretion following consumption of milk. So definitely there is a link between lactose malabsorption or lactose intolerance and infant colic. Dysbiosis حاليا comes at the heart of any problem in life. Any problem in life, not only the GI, starts at the dysbiosis or an imperfect balance in the gut flora. مين سبق مين مش عارفين، يعني هل هي الدysbiosis عملت gut inflammation وكوليك أو العكس؟ هنفضل طول عمرنا بنسأل هذا السؤال. هي it looks complicated، بس أنا هقول الحاجات المهمة اللي فيها. If we have a normal infant gut يعني an infant who's not colicky. This is the bacterial flora that we should expect. A rich population of bifidobacterium and lactobacillus. If we look at the infant with colic, the bacterial flora composition is different. It's rich in gas-forming organisms. Escherichia coli, bacteroids, Klebsiella, Pseudomonas, these are all bacteria that produces gas. So this is the dysbiosis that results in different degrees of intestinal and systemic inflammation. That's what I was telling you. In the infant colic is a state of intestinal inflammation. حبيت احط دي في سلايد لوحدها. Infant colic gastroesophageal reflux disease, is there a relationship? اغلب البراكتس بيحصل فيه ايه؟ ان كل colicky infant at some stage of his life, at some weeks of his life يعني, he was given proton pump inhibitors and being diagnosed as GERD. This is actually not true. The latest of evidence till now is 2018, the statement of Espigin and Nespigin on reflux. If the only presentation of reflux is excessive irritability and crying, يعني ممكن أحط بين قوسين infant colic, it's unlikely to be gastroesophageal reflux disease, and we have to deprescribe PPI. Other etiologies, the biologic and the psychosocial. It might represent an early form of migraine, of infant migraine. It's proven that mothers of colicky infant are double the normal complaining of migraine. Hypersensitivity because of the extreme environmental stimulation and altered pain perception is another. How the caregiver perceive the problem, how they react to the problem is another etiology. Exposure to tobacco and nicotine during pregnancy, not only during the period of lactation, is one cause. So if you meet an infant with colic, what is the most important thing that you should do? The first visit essential is to observe if there is any red flags or not, and red flags can happen in less than 5% of infants who present with colic, and you should be able to recognize if it is a clinical emergency or not, and definitely it can be. How do you do that? You do that by very careful history and examination. Careful history and examination مش بس بيساعدني أعرف ال red flags، لكن هو كمان بيدي للأهل إحساس إن you're taking their complaint very serious, which is very important in all functional GIT disorder. If you just tell her this is normal, every infant cries, you lost your patient. يعني مش you lost يعني فقدت communication. Okay, so careful history and examination to identify red flags, and these are situation that the infant can present in a very irritable fussy state, otitis media, oral moniliasis. If you can see this photo down here, a corneal abrasion, hair tourniquet, which is very serious, trauma, which can happen, of course, if the patient is very distressed, intussusception, the painful episodes of crying. You think it's colic, it's not. When is infant colic a clinical emergency? If you can observe a very anxious parent, a very distressed and depressed mother, clinical emergency here because it puts the infant at a high risk of child abuse, shaken baby syndrome. And there's a very common quote في colic clinics بره عندهم colic clinics. quote كده بيعلقوه في كل حتة: take a break before you shake. If you think that you're very much at the verge of breaking down, take a break. What are the strategies to cope? Once you identify, you're not able to identify any red flags, and you don't recognize the colic as clinical emergency, you have to follow this pyramid. The pyramid starts bottom up: rest, first line intervention, case-by-case intervention. The rest is the acronym for reassurance, and this is number 1 and 10, showing empathy. يعني أنت مقدر قوي المشكلة وحاسس بحجمها. Support, explain what's happening and when it will going to end, and it's going to end. It's not your problem. The baby is not sick. He's well. You're not doing anything wrong. بالعربي والبإنجليزي كل دي جمل very reassuring, and the evidence says that it is one of the very important intervention in all functional GIT disorders, and one of them of course is infant colic. First line intervention, كل اللي هقوله بعد كده سواء كانت first line interventions or case to case intervention, the evidence is not very strong. The evidence is very thin, but these are interventions, in most of it are harmless intervention. They might be very helpful intervention to ease this difficult time in the infant, in the parents and family life. Although the evidence right now is not very strong, but maybe later we're going to get some strong evidence. Adjustment in the feeding technique, addressing the issues of oversupply or undersupply, painful breast condition, instructing the mother to do prolonged breast emptying because this allows the infant to have a lot of fat. And fat actually decreases the gastric emptying and allows more time for digestion to happen. Soothing techniques. Soothing techniques are very fun because soothing techniques هي الابليكيشن الدايركت للميسنج فورث ترايمستر، ان انا بحاول ارجع الانفنت تاني كانه intrauterine. I provide visual واuditory stimuli وsome tactile stimulation تشبه الانترايوتراين لايف. Swaddling is one of them اللي هو القمطه اللي هو تلف لفه جامده to create a very warm environment شبه الانترايوتراين لايف. very famous. السوريين اكتر ناس بيعملوه، والفراعنه كانوا بيعملوه زمان. عشان ما فيش صوت فانا همثل الصوت ده. Sushing or the white noise. You can close your eyes and listen. أنا هنام. Sushing is the sound of blood flow in the uterine artery. فأنتوا متخيلين هي بتقول له إيه؟ بتقول له you're back inside. This is very nice. مش أبداً شبه صوت الهوفرز، شبه صوت المكنسة which is the white noise. في أجهزة بتتباع على النت وعلى أمازون white noise علشان الأولاد، بس it's not like the sushing. Sushing is great. stomach position حاجة اسمها arm drape اللي هو أحطه على إيدي كده زي ما الصورة معمولة، بالذات لو في skin to skin this is perfect. swinging مش كده swinging. sucking of course is the icing on the cake. أحلى حاجة الولاد بيحبوها. case by case intervention. Cow milk diagnostic elimination trial. Of course, you're justified to try elimination of cow milk for 2 to 4 weeks. If you have the suspicion I told you about, consider 2 weeks elimination. If you have no response, stop the trial. It is not cow milk allergy. If there is a clear response, you have to reintroduce milk again in the diet, and if the child shows a relapse, يعني shows an increase in colic, then definitely he's cow milk allergy. If not, then please look for other causes. Because أولاد كتير قوي تشخصوا allergy عشان عندهم colic, and this is حرام برضو. Lactase supplementation. احنا قلنا ال evidence behind ان lactose ممكن يكون له دور. طب ال role of lactase enzyme supplement ان انا ادي اللاكتيز اللي ناقص ده من بره. There are several studies showing that pre-incubation of the feed، يعني لو حطيت في اللبن او اديت للطفل lactase enzyme supplements ده بيحسن جدا الكوليك symptoms subjectively وبيقلل البريث هيدروجين الهيدروجين excretion in the breath which is a reflection of lactose intolerance. Another study showing the efficacy of lactase supplementation. اللي على الناحية الشمال ده الأولاد اللي أخذوا lactase for 2 weeks, there is significant reduction in the crying time. And everyone who uses lactase enzyme supplementation can feel this difference in a big group of patients. This time, this improvement is expected like 2 days, 2 to 3 days after starting supplementation with lactase enzyme. So actually, this is a very good result. I'll introduce this product by name because actually it is the first product in the Egyptian market supplementing the lactase enzyme. زمان اللي كنا بنحتاج نجيب لاكتيز من لعياننا كنا بنجيبه من بره. Now it's available in the market. It's a Spanish product actually. It is a lactase enzyme supplement. It's provided in bottles of 15 milliliter. حوالي 300 دروب. مهم نعرف كام دروب لان احنا بنحسب الدوز بالدروبس. كل دروب بتدينه 150 lactase enzyme, 150 units of lactase enzyme, and this is very good. It is safe because there is no systemic absorption, so you're very safe about it. It's convenient to use, I'll just tell you, and it is acceptable. It doesn't alter the taste, it doesn't alter the smell, the color, anything of the breast milk or the formula milk, so that's or any other milk actually. If your child is breastfed, you don't need to do any adjustment. You just put 1 drop per kg directly in the mouth before the feeding. If the child is formula fed, you have to add 1 drop for every 20 milliliter of milk, leave it to settle for 5 minutes, and then introduce it to the baby. You don't need to change the formula. You don't need to do any other thing. This is a very nice product. Lactase supplementation goes beyond colic. So the role to supplement lactase is not only in colic. I'm trying to focus on colic because this is the topic today, but you can use lactase enzyme supplementation in different malabsorption states which are associated with secondary lactose intolerance اللي هو كان الناحية الثانية من الجدول اللي أنا حطيته, post-diarrheal illnesses يعني persistent diarrhea طبعا, GIT mucosal damage, or even my very favorite use is in functional GIT disorders in the irritable bowel syndrome as part of a low food map diet. يعني في رأيي ده أهم من الكوليك سوري يعني. Okay. The probiotics use زي ال rotary by name because this is what the evidence tells us could have a role in decreasing the crying time. This role is pronounced in breastfed infant, not very highlighted in the formula fed yet. Use of simethicone زي اللي كلنا بنستعمله ب preparations مختلفة. Little evidence to support, but again it's a harmless intervention. Simethicone بياخد الجاسس كده we coalesce them together and you expel them upwards. It's good, not bad. Other approaches زي herbal or homeopathic remedies, gripe water, fennel extracts, del oils, كل دي حاجات فيها volatile oils كتير. فالvolatile oils بيبقى ليها dopamine-like effect. It relaxes the intestine. No evidence, but it's not bad and it's not harmless ما عدا حاجات معينة. Infant massage, chiropractic or osteopathy, acupuncture, infants with colic grow into children with colics. في حتى statement معروفة بتقول small belly acres grow into big belly acres. If he had colic when he's young, he'll probably have recurrent abdominal pain, allergic diseases as atopic dermatitis, food allergies, sleep disturbances. الستيتمنت دي أو saying دي أرسطاطل قالوا من زمان the more you know that you don't know. So what do we do when we don't know? We do no harm. We shouldn't do any harm. Do not provide an intervention which carries any risk or harm to the patient. Number 2, we do more research because more research provides more evidence, and more evidence can change your answers to questions that you thought you had all the answers to. And colic is a perfect example of this. Thank you very much.